How is it possible that somebody could move from AC, air conditioner, to ICU? Hello and welcome. In this video, I'll be talking to you about a condition that, though rare, could occur. And very interestingly, AC to ICU, I mean, exactly what's going on here. Well, we know that AC is air conditioner and ICU is intensive care units. So how is it possible that somebody could move from AC, air conditioner, to ICU? So essentially, we're going to be looking at this condition that could cause this. I'll be looking at the symptoms, how a doctor makes the diagnosis, and what you can look out for. And so I expect that you will stick around through to the end of this video. So what exactly could be going on here? We know that AC should usually be safe. I agree with you. But again, if you're in an environment where there's a high volume of traffic, there is a chance that the water system in that environment could become contaminated. We're talking about places like a hotel, offices, hospital, spa, pool, hot tub. These areas are prone to having the water system contaminated because of the heavy duty traffic of humans. So what essentially happens is that, for example, an air conditioner could become, the water system could become infected, and as clients to a hotel, somebody that was just going there for a night or two, you slept in that room, and without knowing, you inhaled aerosols, which are tiny droplets of water, which might have been contaminated by an organism. Now, you could, at the end of the day, present with a condition called Legionellosis. If you're not a doctor, you don't need to bother about this next 1 or 2 points I'm going to make. Now, this condition could be caused by an organism called Legionella pneumophila. Don't worry about the name of the organism. But essentially, it could present in two forms, perhaps more, but I'm going to be talking about two forms. Number one, Pontiac fever. In Pontiac fever, a patient presents with flu-like symptoms such as headache, muscle aches, feeling tired. The good news about the Pontiac fever is that it could self-resolve. In other words, a self-limited disease, which means that it could resolve spontaneously without requiring treatment or intervention. The second one is the one I'm interested in, which is the one that can move a patient from AC. In other words, you spend the night in an air-conditioned room in a hotel, and then next thing, 48 hours or thereabout after, you're in the hospital. Now, it's important that you pay attention to this B section, which is the Legionnaire's disease. We talked about Pontiac fever. Now, this is Legionnaire's disease. What's so important about this is that it's beyond the usual type of pneumonia, which could affect the lungs. Here, we're dealing with an organism that could affect the lungs, the brain, and the gastrointestinal tract. When it affects the chest or the lungs, it could present with chest pain, chest discomfort, shortness of breath, hemoptysis, which means coughing out blood. So the patient could either simply be coughing, producing sputum, or producing blood in the sputum, what we call hemoptysis. If it affects the gastrointestinal tract, it could present with diarrhea, and if it affects the brain, it could present with confusion. And this can be confusing because here is somebody that was quite fit and well, went somewhere, spent a night or two in the hotel, and then 48 hours after, he's presenting with all these manifestations. In addition to this, in Legionnaire's disease, you could also have presentation with fever as well as flu-like illnesses. What should you do? When you present to the hospital, what the doctor will look out for, because even the doctor will require a high index of suspicion to suggest that this could be the condition. And so what the doctor will do is to carry out the chest x-ray. But the very important investigation that needs to be carried out here is the urine antigen test will help to pick out a molecule of this organism in the urine sample, and this will be diagnostic. What should the doctor do? Antibiotics will be required. The specific type will fall under a class of antibiotics referred to as fluoroquinolones. In addition to that, you could require oxygen if the patient is quite ill. And so we're dealing with a situation where a patient can move from a customer, a client in an AC environment in a hotel, and now a patient in the ICU. So what should we look out for? When you visit a hotel, we need to pay attention to a few things. Number one, 24-48 hours after you've left the hotel, the hospital environment, the spa, the hot tub, pay attention. Are you developing any fever? Are you becoming breathless? If you notice this, if it's just flu-like symptoms that wear off after a few days, that's fine. But if you notice that this is becoming persistent, and then in addition to that, you are coughing up blood, please do not waste more time. You need to visit the hospital and see a doctor. Thank you. I hope you've learned something. See you again.